My name is Stacy Dunn. I am the Advanced Workshop Consultant with CQ Partners. In addition, I also co-facilitate our sales intensives that we have several times during the year. So prior to joining the CQ Partners team, I've been a provider for about 16 years, working in the Northern California area. I come from a background of a multi-practice office where we had 5 locations, where I was also the director of training. So I had the opportunity to mentor and coach all of the new providers that came to work with our office. I have also been a practice owner, so I do understand the different aspects and needs of the hearing healthcare practice. So during the advanced workshop, my goal is to help support the providers as well as the practice owners to help develop and get a replicatable process for what we do outside of the booth. And when we do that, we work side by side in a collaborative manner. We see patients one after another for 3 full days. And the way I can help support you is we handle those objections that we see often during our patient interviews and during our HAEs. So when we work side by side together for those 3 full days, we build kind of a sustainable process together that it will be replicatable after the workshop is over and you'll be able to use going forward in your daily routines. What makes the advanced workshop so valuable for a practice is threefold. Coming from the patient's perspective, we have a much more educated patient now, and there's a lot of information in the industry that's inundating them. We want to support you in having your patients come back to you as the expert to gain that information from your office and not seek it from your competitors. So for the patient's perspective, when I come in and I help support you through this marketing event, the patients are gaining that and reestablishing that trust with you that you're always going to be looking for the best care for them, and we're weeding out the different kind of controversial information that's available to them. From the provider standpoint, I think this has the most value in that when we work side by side with your providers, we are able to handle all those objections that we get during the HAEs. We handle cost objections, I'm not ready objections, and we all have that specific process in the booth. We do the same process, the same diagnostics. When we get out of the booth, it's where we kind of don't have a routine set of steps that we take. So going in together with you and your providers, we build that momentum. And when we have that momentum, we get excited again and we help more patients. From the owner perspective, it gives you an opportunity to have someone else like myself come on in and help kind of mentor and train with your providers, because if you're a provider as well, you often don't have time to keep seeing your own patients but spend that one-on-one time that you want to with your providers. So we have that provider training, we build momentum, and then also in addition, we bring in quite a bit of revenue. So for that 3-day process wrapped in that marketing events, we're getting patients more help, our providers are building more confidence, and we're keeping them sticky to your practice as well as bringing in a large sum of money for revenue for that month. So my personal approach to helping patients is that I believe every patient that comes into the office deserves to hear better when they leave than when they came in. And I also believe that oftentimes patients are much more vulnerable than they're admitting. They'll all say that I'm fine. Creating that safe space where a patient become vulnerable and really offer up what might be worrisome or not working well with communicating with their loved ones. I feel like that's my responsibility to pull that out of them, give them that safe space, but then also to motivate them to realize that hearing devices is not a punishment. It's exciting, and when they get to enjoy those conversations again, and I get to see them bloom when they wear their hearing devices, my philosophy is that they're coming to me for a reason, and I'm there to be diligent and motivate and help them leave with better hearing than when they came in.